Ever had a nosebleed and wondered why it happens? Today, we're diving into the intriguing world of epistaxis, a medical term for nosebleeds. This common phenomenon can be a cause for worry, especially for parents, but rest assured, most nosebleeds are benign, self-limiting, and spontaneous. However, some can be recurrent, and there are also many uncommon causes. Epistaxis is divided into two categories: anterior bleeds and posterior bleeds, which are classified based on the origin of the bleeding. Now, if persistent heavy bleeding is present, it's crucial to obtain a hematocrit count and type and cross-match. When there's a history of recurrent epistaxis, a platelet disorder, or neoplasia, a complete blood count with differential is necessary. Visual evaluation plays a crucial role in diagnosing epistaxis. Direct visualization with a good directed light source, a nasal speculum, and nasal suction should suffice in most patients. However, in certain cases, more advanced imaging techniques like computed tomography scans or magnetic resonance imaging might be necessary. Nasopharyngoscopy may also come into play if a tumor is suspected as the cause of bleeding. Now let's talk about the management of epistaxis. Most patients respond to cauterization, nasal packing, or both. For those with recurrent or severe bleeding unresponsive to medical therapy, various surgical options are available. Following surgery or embolization, close observation for any complications or signs of rebleeding is crucial. Medical approaches to treating epistaxis include adequate pain control in patients with nasal packing, oral and topical antibiotics to prevent rhinosinusitis and possibly toxic shock syndrome, avoidance of aspirin and other non-steroidal anti-inflammatory drugs, and medications to control underlying medical problems such as hypertension or vitamin K deficiency. When it comes to arterial ligation, the vessel to be ligated depends on the location of the epistaxis. Generally, the closer the ligation is to the bleeding site, the more effective the procedure tends to be. In some cases, embolization might be the best way forward to control bleeding, either as a primary modality in poor surgical candidates, or as a second-line treatment for those for whom surgery has failed. In summary, epistaxis is a common but often benign medical occurrence. It can be categorized into anterior and posterior bleeds, and can be managed through various medical and surgical methods. Understanding this condition is vital, as it helps alleviate unnecessary fear and aids in effective management. Remember, knowledge is power when it comes to health matters.